Bismillah ar-Rahman ar-Rahim. This is a 70-year-old male. He was complaining of shortness of breath at night with bilateral leg edema. The past medical history of this patient, he got ischemic heart disease. He had a CABG a few years ago for 3 vessels, and he now in failure after the CABG. He is ex-smoker, stopped a few years ago. He used to smoke 40 cigarettes per day for more than 40 years, 50 years, and he was a hypertensive. Family history of ischemic heart disease was negative. He had hyperlipidemia and hypertension. Therefore, is a lot of risk factor. Risk factor: elderly, male, smoker. He is hypertensive too. These are the most important risk factor in this patient. That's why he got ischemic heart disease, 3-vessel disease. Usually 3-vessel disease, we got it in diabetes, but sometimes you get it in others. Okay. Therefore, he put on the following drug, drug. He been put on anti-lipid, atorvastatin, at the morning. He been put on valsartan, 160 milligram at the morning too. Where he was put on digoxin at night, where he been given Lasix 2 tablets per day, and this is antiplatelet, and this one is isocard, 10 milligram 2-3 times per day, coronary dilators. Okay, the question here, what is wrong in these drugs? What is unusual or making patient risky by these drugs? Wali? Yes, and who given digoxin with diuretics, loop diuretic, might shift the patient to hypokalemic state if he used that diuretic for a long time, and making digoxin is what? Toxic. And you know digoxin actually they have a therapeutic action and toxic action. They are both nearby. That's why if you give digoxin, you might shift your patient to toxic level in the serum, and because it's narrow in between the therapeutic and toxic level. Therefore, loop diuretic is risky. Okay? Why digoxin being given at the morning? Digoxin should be given at night. Why? Why we insist to give digoxin at night, not in the morning at all? Why? Yes, because this drug you have to measure the therapeutic level, and therapeutic level should be measured early in the day, say 9 o'clock. It takes 4 to 6 hours to complete it. If you give the digoxin at the morning, and usually the doses started at 10 o'clock, and the duty end by 5, there is no time to take a blood and to go to the lab and you do your study for digoxicity. While if you give it at night, you will get digoxin level already. If you take your blood early in the morning, you can finish and you get result of digoxin at the same day. Okay, there is no delay. Okay, therefore, the best thing to do what in this situation, he need to have diuretic. You have to give what? Potassium sparing diuretic, aldactone. He is on aldactone 25 milligram twice per day, and should be given at what time? Morning and evening, and after meal or before meal should be taken after meal. Why? because it is causing gastric troubles. You have to give it after meal. Okay. This atorvastatin is anti-lipid. Okay. It's given at the morning by his doctor. Is that good or bad? We know that cholesterol or lipid forming from the liver, it is usually starting at night. And if you give your anti-lipid at night, probably you will stop 50% of that production by these drugs. Okay? Why his doctor insists to give this atorvastatin at the morning?
Active at morning and night, at day and night.
Yes, there are two drugs. Atorvastatin, one of them, can be given at the daytime and night. Atorvastatin, the second one, rovastatin. These two drugs can be given what? At the day and at the night, and the same action and the same effectivity. Okay? Good. We suggest to omit digoxin. Why? Digoxin is inotropic. Digoxin increases the ejection fraction. Digoxin, clinically the patient get better. Digoxin, the effort of the patient get better. Why you omit it?
There's toxicity, sign of toxicity.
Because of the toxicity first, and it doesn't affect the prognosis. Digoxin, it doesn't affect the prognosis of the patient, while the other affecting the prognosis. Is there any element of beta blocker in this patient? Yes. Beta blocker can be given in heart failure. It was at the day when I was a student, the beta blocker is contraindicated in heart failure because it shifts your patient from chronic heart failure to acute heart failure. Therefore, it's absolutely contraindicated. Nowadays, no, they found that beta blocker is quite good for the heart, at least relieving the sympathetic action, side effect of sympathetic action. It is quite good, but you should start it with what? Small dose. You should start it with a small dose, a very small dose, and increase it weekly, and you reach in your dose at 3 months, not in a few days, not in a few weeks. 3 months you give your patient beta blocker to get the good benefit of beta blocker. Okay. Therefore, valsartan.
Angiotensin receptor.
It is Arabs. Angiotensin receptor blockers.
Cut angiotensin aldosterone system. Cut angiotensin aldosterone system.
It blocks the angiotensin 2 on the heart, on the kidney, and what else?
Lower blood pressure, decrease remodeling, improve mortar, improve
Yes.
survival.
Yes, actually the action of valsartan اللي هو Arabs is just the same as the action of ACE inhibitors. It's quite good for the patient. But the action of this drug is not more than 17 or 18 hours. Then, if you want to cover it, you cover it with a second antihypertensive drug. اللي we can give what?
Either beta blocker or amlodipine.
Yes, but he is in failure.
He's in failure.
Yeah, do you get it? It's thiazide diuretic. Is it? Suppose this patient is a female and she got osteoporosis and she got hypertension. What preferable drug you should start it first?
Thiazide.
Why you starting with thiazide first for her hypertension?
Make hypercalcemia.
Yes, because thiazide side effect is hypercalcemia in the blood, and hypercalcemia is quite good for what?
Osteoporosis.
For osteoporosis. Any questions? Thank you.